So our next panelist is Juan Chamie. I have talked about him once before as well. He's a senior data analyst who has been tirelessly researching and spreading the word of ivermectin since early May 2020. So in his discussion and his follow-up, so we would love to know what is he found worldwide, how the ivermectin is being used, and what are the results of that. So let's start with, let's welcome Juan as well. So Juan, take it away.
So thank you very much for having me. Uh,
Very welcome. Thank you very much for being here. Thank you for your time and your insights.
try to start it.
So the
I think this is not working. Hello, everyone. Thanks to all of you for having me here. I'm excited to show you some real world data about ivermectin use and the impact in COVID today. There is a lot of information to go through, so I'll jump in right in and I'll be happy to answer any questions later on. This is what I'm going to present, an intro on how did this research journey start, Colombia, effectiveness of a solitary public announcement, Mexico, how a test and treat strategy is changing COVID-19 figures, and finally Slovakia and Czech Republic, results in 2 European countries open to try ivermectin. The first, when Jose Natalio Redondo, a doctor in Dominican Republic, used this drug successfully and shared his first 500 successes. Right after, an outbreak in Iquitos, Peru, grabbed my attention, especially how a small group of people distributing ivermectin in mass curbed the disease. After that, the same pattern is happening again and again all over the world, and I'm trying to capture the most accurate values and share them. So let's start with the first case, how one solitary announcement increased ivermectin use in Colombia and changed the disease outcome. So early in July last year, the mayor of Cali, one of the biggest cities in Colombia, announced that he was planning to use ivermectin to treat COVID patients because some doctors' experiences showed that ivermectin was effective in treating COVID. Right after his announcement, most health officials in Colombia opposed what he was saying. The Minister of Health was against it. The Colombian FDA was against it. Even the president made a statement against it. And the mainstream media in the country also supported the position against the use of ivermectin in the country. So, and because it was all over the media, the interest in the drug increased a lot in the country. As you can see here, Google searches reaches a new high. And that doesn't mean that people were buying more ivermectin, but it's a good indication. And also it's important to know that in Colombia, ivermectin costs between $2 and $10 per unit, and you don't need a prescription to buy it in any pharmacy. But in addition to Google searches, sales also increased. Look at the sales in Colombia in July and August 2020, compared with the same month in the previous year, or compared with the month prior. But also notice that here in the north of the country, the sales were more predominant than the rest. So COVID cases and fatalities, what happened? During these 2 months, both cases and fatalities stopped growing and then plateaued. And after, there was a drop. And if you look at the mobility, there wasn't a reduction in mobility that could explain the decrease. It was pretty much the same. Is the drop enough evidence? No. So how can we better test the effectiveness of ivermectin? If ivermectin is effective and some people are using it, the overall case fatality rate ratio must decrease. So was there a reduction?
Juan, I think we are on
A
the.
reduction in case fatality ratio? Or was there a reduction in the case fatality ratio in the elderly? Or was the reduction in the case fatality ratio in the elderly different in regions that use more or less ivermectin? This is the question we need to solve. So here I'm comparing different periods of time before and after the increase in the use of ivermectin. So, and if the increase impacted the case fatality ratio. And 8 weeks before and after the change in the use of ivermectin. So the first table, this one, the first table shows the entire population of the country, 50 million people. So you can see that before the intervention, here, before intervention, case fatality ratio was pretty much the same every period, 4.5, 4.7, 4.8, pretty much the same. But if you look at after, it was a decreasing, 4.1, 3.9, 3.8, 3.7. And yeah, so comparing the periods before and after, the difference are important. 0.38, 0.83, 1.01, and 0.109. And the difference are statistical significant. See, p-values, this is 1 in 1,000, and this is just almost zero, very close to zero. So let's look at people over 60. If you look at people over 60, you can see the same behavior, the same drop before and after. If you look at the case fatality ratio before, 2 weeks before, 4 weeks before, 8 weeks before, 6 weeks before, or 8 weeks before, there is not a difference in the case fatality ratio. But if you look at the after, it's different and it's decreasing. The difference is bigger than the difference in the entire population, and the values, the difference are statistical significant, and the p-values are extremely, extremely, extremely close to zero. So now look at the population over 80, same result, a noticeable drop in case fatality ratio, and a difference that is statistically significant with a very, very, very small p-value. It's compelling, right? So now let's take a look at the performance of group of states split by ivermectin per capita sales. I selected states with the highest sales per capita and the states with the lowest sales per capita. I make two groups, each group with 10 million people. So over 40% of the country's entire population is represented here. And the difference in sales per capita is very important. It's like 8 times more ivermectin use in the group A than in the group B. So let's look at the group A. This is the all age group and the people over 80. 2 weeks, 4 weeks, 6 weeks, and 8 weeks, before and after. Big differences, big differences. In the all age group, differences statistical significant, and the people over 80, even bigger differences, and the same p-value, very, 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 very close to zero. So let's see what happened in the group B. So in the group B, where the states use small amounts of ivermectin, there is no drop in case fatality ratio. Not in the group with younger population or in the group of the population over 80. And the difference are not statistical significant. The p-values are from 0.21 to 0.67. And finally, look at the group A, it's blue line, with a dramatic drop in case fatality ratio. And the group B is stable. This is each point is a group of two weeks. Mexico, how a test and treat strategy is changing COVID-19 figures. So on January 22nd, the head health official in Mexico City, Olivia Lopez, announced in a press conference that they have been using ivermectin to treat COVID patients since December 29, 2020. She confirmed the use of ivermectin 1 week later. Also, two different health officials, as well as the head of the IMSS, Instituto Mexicano del Seguro Social, confirmed that they were using ivermectin too. I checked public purchases databases in Mexico to confirm myself, and as you can see in this table, ivermectin purchases increased noticeable from the last week of December. And the purchases in 2020 were just few. These public announcements made people more aware of ivermectin, as you can see in this Google graph trend. This January 22nd, the peak. And it's also important to know that ivermectin costs around $7 in Mexico, and you don't need a prescription to buy it. So looking at the test and treat program results, you can see an impressive drop in cases here, and an even more impressive drop in deaths. The blue line represents people who tested positive, and the orange people who tested negative. So because they are only using ivermectin to treat those who test positive, you can see that the drop is dramatic in the people tested positive, but not in the people tested negative. Case fatality ratio is also showing an improvement, as you can see here. People infected within the first 3 months of 2020 have lower case fatality ratios than the expected values that could be provided here. And right now, the positivity rate is the lowest since May 2020, from almost 50% all the time to less than 20%, and it's improving. You can see it, beginning of this in January, when they started the program. And if you look at the hospital capacity, the numbers are really good. There isn't a state with more than 30% occupancy in beds. The highest occupancy is Puebla with 27%. There are in states with more than 4% occupancy in hospital beds with ventilator. The highest is Chihuahua with 36%. And there are only 2 states with the ICU occupancy higher than 50%. The rest of the country is like 20, 10%, 30%. Now look at excess deaths. In Mexico City, the first week of April here, there was a 6% rate of excess deaths, 6%. And the mid-January was 280. That's a mind-blowing drop without the strict lockdown and in the time of new variants. And the excess deaths in the entire country is also disappearing. The first week of March, excess deaths in the entire country, excluding Mexico City and Mexico State, were only 6%. I'm pretty sure right now they have negative values. Yes, negative excess mortality, fewer deaths than was expected or than the previous years. Like Chiapas. Chiapas started using ivermectin in July 2020, and since then, they have between 20 and 40% fewer deaths than the historical values. Slovakia results in a European country open to treating COVID-19 with ivermectin. Slovakia approved the use of ivermectin at the end of January, but the drug has only been widely available for March. The interest in ivermectin grew the week the drug was more available. Comparing the interest in ivermectin against the interest in the COVID vaccine, here, it's noticeable that during this week, there were eight times more search about ivermectin than search about the vaccine. And if you look at the global searches, the proportion is quite the opposite. Cases have been sharply dropping since the end of February. Both cases detected by the AG test or the PCR. And at the end of February, they were seeing over 5,600 cases per day. And right now, cases are about 1,300, a 75% reduction. So maybe it's because they are testing less. So let's look at testing. If you look at the positivity rate, right now, the positivity rate in Slovakia is 0.5%. And in January, it was similar to that of its neighbor countries. So it wasn't different in January. So look at hospitalizations. Hospitalized patients also are decreasing from almost 4,000 patients in hospitals at the end of February. The number has dropped to 1,500. And the numbers are decreasing every day. This is the last 3 days. Look at the numbers. 80 less people in hospitals, 90 less people in hospitals. And it's happening the same in ventilators or people in ICU, also decreasing every day. Let's look at fatality. Fatality daily count is showing exactly the same pattern. From 105 deaths per day at the end of February to 15 2 days ago. It's a reduction in deaths of 7-fold in less than 2 months. But recently, the data reported doesn't match. It's very important to clarify that there is a mismatch in the daily deaths report. Lately, there has been a big difference between the daily public death report and the official database. Looking at the day of the deaths, the blue line, there is a drop. But looking at the day of the report, there isn't a drop. So the deaths are pretty much the same. This is every point is a week. So day of deaths report is dropping, but day of the official report is not dropping. So who's right? So when they update the reports, they update three things. First, they update the registers to add more information. For example, the gender or the place where they die or the region. The second is like normal updates. They update new data. So this is the updates from April the 9th. So you have the same day, the previous day, like recent dates. And the third is all data. And this is what is happening. This is data from January, as you can see here. So adding all registers, they are adding very old registers in the daily report. So what is happening now is that they are adding this huge amount of old registers. They are including people who died in January and February, and they are showing them as numbers of April. So I checked this with the official in charge in Slovakia, and he confirmed that the coroner's office have received many reports from January and February. So here is more clear how the new data is affecting the curves. New registers are mostly deaths happening before March. See, this is the previous report, and this is the new report. This is day of deaths, and this is the report. So they are reporting the cases that happened in February, in April. And finally, as a confirmation, comparing the cumulative deaths in the official report and the database with the day of deaths, day of death has almost 200 more registers. So it's even more accurate, as you can see. This is the report that's showing the like more than 60 deaths per day in the last week. And this is the report showing that recently there are like 15 people dying on it. And they have more registers than this one. So I think it's clear. So what is happening now in Slovakia? Slovakia is opening shops, is relaxing its quarantine, shops, gyms are reopening, and life is getting back to normal. Good for them. Czech Republic results in another European country open to treating COVID-19 with ivermectin. So Czech Republic approved the use of ivermectin the 3rd of March. So yeah, over here. The interest in ivermectin grew in the same week of the approval, as you can see here. The interest in ivermectin against the interest in COVID vaccine was 6 times higher this week. And if you compare with the UK, is quite the opposite. So cases have been sharply dropping right after the approval. You can see here. From 12,000 patients with COVID or new cases per day at the end of February or first week of March, they have now 2,600, 78 reduction in cases. You see, it's because of testing? No, no. Right now, the positivity rate in Czech Republic is only 2%. And after the approval, was like any other country around them. Right now, they have a better positivity rate than Germany, than Hungary, than Poland. So hospitalizations, the total number of people with COVID in hospitals is also decreasing. From 9,100 people in hospitals in March 15, the number has dropped to less than 4,000 people in hospitals. And the numbers, as you can see in the graph, are going down every day. Patients in the ICU, same. The total number of COVID hospitalized patients in the ICU are also decreasing from over 2,000 at the beginning of March. Now there are only like between 800 and 900 patients in the ICU. And the numbers are decreasing every day. Deaths. Fatality count is showing the same dramatic drop from 215 deaths per day at the mid of March to 75. And it's going down. So maybe deaths are going down because of vaccines. They have vaccinated everyone older than 70. So maybe in the younger population, there is no drop. So let's look at the deaths in population younger than 70. Is the same. Is the same drop than the drop in the entire population. So what is happening now in Czech Republic? Last week, the last update, Czech Prime Minister says relaxation of more restrictions possible this month. So this month is next week. Good for them. So what about India? I will publish a complete analysis soon at Realside News. Thank you.
Juan, what an awesome data processing and sharing. This was mind blowing. So, of course, being doctors, we talk about the drug and side effects and the usage, but have never seen the data to be looked at in this detail and with this precision. So, thank you very much for doing this work. I really
Thank you.
wish that we could actually have you one-on-one as well for the audience and talk more about the data. So, tell me this: the thing that is very curious for me is this data presented to authorities and medical leadership organizations? What are the reactions? Have you done that?
I haven't presented directly to the like different audiences, like policymakers, but the FLCCC is using this data to show to different people, and what they said is when they present the clinical trials, some response is maybe there is some co-founders or is a small test or like something else, but when they present the data, there is like no response. This is because you can't say anything against this. What is the reason? So I've been seeing this data since May last year in Peru, and in this study in Peru, I like checked like 10 different co-founders, and none of them were like the reason of the drop. And if you look at now, they have this drop, the dramatic drop in August, September last year, and they stopped using ivermectin, and they have now like a almost 300% excess deaths every day since the beginning of February. So it's like 3 months with this huge amount of excess deaths. But so it's.
So if I can loop in Dr. Lori here as well. Dr. Lori, the data that Juan has, is Bird Group working with that data as well to further, so you have the data for evidences?
In actual fact, in February, so after we conducted our systematic review, we included our review in an evidence to decision framework, which is the standard way that WHO presents evidence to their guideline development panels. And in that, we included a lot of Juan's work, which was, it's enormously powerful. So we had the data up until, I think it was the 20th of February when we held the meeting. And the data that Juan had at that point was for Peru and Brazil and India. So this new data is really amazing.
Got it. So one more question to Juan. I'm seeing this question here in the questions tab as well. And for the audience, please, if you have a question, please put that in Q&A. It is easier to curate it from there compared to from the chat. So Juan, another question, and you touched on that for the India and Brazil. So you said that the data is coming soon. What do you see? Can we get some sneak peek of what you are looking at?
Okay, Brazil I'm amazed with the press that is like looking always at the wrong direction. So right now, Brazil is kind of controlling the pandemic. They if you look at the official data of the hospitals reporting people with like just symptoms, it's dropping in every single state. So this is Brazil. And also in Manaus, they started using ivermectin at the middle of January, and 2 or 3 or 4 weeks later, they have normal amounts of deaths. And why? It's not possible to like just the virus just decided to go away and don't like stop infecting people. No, it's because they are training people. And in India, what I'm seeing is that they started this new outbreak in Mumbai. They never stop cases in Mumbai, and they started vaccinating too. And there is now there's information about this new like double mutant variant. It's a variant with 2 different spikes, and this is probably the reason. And what happened in Mumbai is they have this huge outbreak. People are more interested right now in remdesivir than ivermectin. There are like almost twice more searches about remdesivir than ivermectin. And in Mumbai, they started a lockdown. So people working from other states in Mumbai, they just moved to the normal places. So there was a huge amount of people moving in the middle of the pandemic, in the middle of the break, from Mumbai to Lucknow, the capital of Uttar Pradesh. So they received this huge amount of people infected, and they've been trying to control the pandemic. And it's amazing how the press is just looking at what they want to show. If you look at the numbers in Uttar Pradesh is at the population of Brazil, and they have been reporting less than 200 deaths per day in the last 5 days. 200 is, if you look, is like a 5% increase in the excess deaths, only 5%. And this is under control, kind of under control. And in the whole state of 230 million people, they have 200 deaths. And in Delhi,
interesting,
they have only 50 million and almost double the deaths per day.
Very interesting. So I think, Juan, we're going to follow you and your data and Bird Group, and we'll continue to see what is going on. A couple of questions here in the question window. One is from Mayor Hughes. He says, How does the data in Slovakia and Czech Republic compare to the seasonal drop in cases and deaths seen in the UK without widespread ivermectin use?
I've seen this. I think that it's a very important value to track is the positivity rate, and I'm seeing the same increase or decrease in positivity rate in the UK than I'm seeing the same in places with a mass use of ivermectin, like Slovakia or Czech Republic. I'm seeing the same in Panama, and it's the same in Israel too.
Got it. So one more interesting question here is the vaccine versus ivermectin. And again, we are not sitting here to compare vaccines and ivermectin, but the question is Czech Republic and Slovakia, is the drop in the cases because of vaccines or is it ivermectin? Do you know, have you processed that data? So this is Jeffrey Taylor.
The vaccination in those countries are not the same as in Israel or the UK. It's like probably 10 or 50%, 15% of the population with vaccine. So I don't think that this drop is because of vaccination.
Got it. One more question by Ingrid Landman. Great talk, thank you. Have you looked at any data from Zimbabwe or South Africa who are using this drug?
It's the same. It's the same. It's yeah. When any country started using ivermectin, like seriously, there is a drop. You can see this amazing drop in Zimbabwe. You can see this amazing drop in South Africa. It's happening now in Philippines. It's in Central America. Central America, they have been using ivermectin since like early days. And if you look at the number of cases are fewer than any other place. Even the president of Guatemala, he was in a talk with other presidents of Latin America, and he was saying we started using ivermectin in June or July. We authorized like pharmacies to make their own ivermectin, and his brother saying we have the lowest drop in the economy numbers than any other country in Latin America because it's working. He even give the prescription to people in the audience.
Very interesting. Thank you very much, Juan. Let me just see if, so Dr. Laurie, do you have any question that you curated or that is in your mind for Juan before we?
No, I haven't, but I would urge the audience who are fascinated with this work to read Juan's papers on Peru, because Peru had been using ivermectin since May last year, and they had massive drops, and then there was a change in policy, wasn't there? And Juan shows us very clearly in the paper the effect of a change in policy where ivermectin then became restricted and the excess deaths went up. So I hope people will look at Juan's work and reference it.
Excellent. So Juan, thank you very much once more. I think that we are going to continue to look at the data that you're presenting. It is a very powerful weapon that is needed to look at the data itself and save humanity. So audience.